All right, trauma care. You wouldn't think a stack of medical guidelines would be, gripping reading for a Thursday afternoon,
Right.
but this stuff is intense. And we're jumping right in with the golden hour, that first hour after an injury where it seems like every second makes a difference.
Absolutely. It's that initial period where the human body is really in a precarious state.
Yeah, it's like the body's on this razor's edge, right? And the right care can tip the scales towards survival.
Exactly. And the source material here calls it out specifically. They actually use this phrase, trimodal distribution of trauma mortality. It sounds complicated, but it's basically saying there are these three peaks of danger after a severe injury.
3 peaks, huh? Okay, so I'm picturing like a mountain range, but instead of peaks, it's moments where things can go really wrong.
Exactly. And the first peak, it's immediate. Sadly, we're talking about injuries that are, well, unsurvivable. Think massive blood loss, major organ damage.
Yeah, that's grim, but it makes sense.
Yeah.
So then that second peak, that's where the clock is really ticking.
That's where expert care can really change the game. We're talking about things like severe bleeding that can be controlled, airway obstructions, things like that. And this is where the source material emphasizes, all those acronyms they use, like CRAMS. That's to assess circulation, respiration, everything's got to be checked rapidly.
FRAMS, okay, I can see how that would be easy to remember under pressure.
Exactly. It's about having these mental checklists because it's not always obvious what's going on. You might have a patient come in with, say, a broken leg,
Right.
but it's actually a silent internal bleed that's the real threat. And that's where a systematic approach is so crucial. The source material, they really hammer that point home.
It's like the human body is throwing a curveball at the worst possible time. You never know what's going to be the real danger.
It's about being a detective, right? You got to look beyond the surface to find those hidden dangers.
It really is like solving a medical mystery, right? But the clues are hidden inside the body.
And the clock is always ticking in the background.
No pressure, right? It makes you realize how vital those first responders are.
Absolutely. They're the ones on the front lines making those split-second decisions. The source material actually compares it to battlefield medicine, this idea of trauma triage.
Trauma triage. So
Right.
you're saying they're out there making these life or death decisions with limited resources.
Exactly. It's about assessing the severity of injuries, the available resources, and sadly, the potential for survival.
Wow, that must be incredibly heavy to have that responsibility on your shoulders.
It's a burden no medical professional takes lightly, that's for sure. But it's also a testament to their training, their ability to stay calm and focused under pressure.
And to think clearly when it matters most.
Absolutely, because you can't save everyone as much as you might want to. Sometimes it comes down to making those impossible choices, prioritizing care to maximize the chances of survival for as many people as possible.
So how do they even begin to prioritize in that chaos? I mean, every injury must seem urgent.
That's where those systematic protocols that we talked about really come into play. Things like the ABC's airway, breathing, circulation.
Why start with the basics?
Exactly. It's about addressing the most critical functions first. And it's not just about speed, it's about strategy. Sometimes the best decision a medical team can make is recognizing their own limitations. The source material talks about the importance of transferring a patient to a facility with more specialized resources.
So it's like a relay race almost, getting the patient to the right runner who can take them further down the road to recovery.
I like that analogy. It really is a team effort, with each member playing a critical role. And just like in a relay race, communication is key. The team needs to be on the same page, constantly sharing information to ensure the patient gets the best possible care.
And part of that communication, I'm guessing, is about those hidden injuries we talked about, the ones that might not be immediately obvious.
Exactly, and that's where the secondary survey comes in.
Right, that head-to-toe exam, making sure they haven't missed anything.
It's about being thorough, leaving no stone unturned, because like we said, sometimes the most obvious injury isn't the most critical.
The source material uses this phrase, and forgive me if it's a little graphic, but they talk about tubes and fingers in every orifice. I mean, talk about thorough.
It sounds intense.
It does.
But that level of meticulousness is often what it takes to uncover those hidden dangers, things like internal bleeding or a small fracture that could lead to something called compartment syndrome.
Compartment syndrome. Okay, that sounds like something I should know more about.
It's a serious condition. It can happen when there's swelling within a confined space, like a limb. If the swelling gets too high, it can start to compress the blood vessels and nerves, cutting off circulation.
So it's like the body's own defense mechanisms backfiring.
In a way, yes. And it can lead to serious tissue damage if it's not caught and treated quickly.
Wow. So this combination of rapid response and incredible attention to detail that makes trauma care so demanding.
Exactly. It's not just about slapping a bandage on a wound and hoping for the best. It's about understanding the intricacies of the human body, being able to anticipate potential complications, and being prepared to adapt to whatever challenges come your way.
It's like they have to be prepared for anything, really.
Exactly. And that actually reminds me of another area. The source material delves into pediatric trauma. It's a whole different ballgame when you're dealing with kids.
Oh man, just the thought of a child going through something like that it's heartbreaking. And to think the source material actually mentioned that children often have better outcomes with head injuries than adults, which seems counterintuitive, right?
Well, it does, but when you think about it, kids, they're still growing. Their skulls are more pliable, almost like a helmet with a little give.
Ah,
Plus,
okay.
they've got more of that cushioning cerebrospinal fluid.
Right.
But here's the thing, their spines, they're actually more vulnerable.
Oh, wow. So it's almost like a trade-off.
In a way, yeah. And the source material uses this term, spinal cord injury without radiological abnormality, or SIWORA.
Siwara. Okay, got to add that one to the medical lexicon.
Right. It basically means you can have damage to the spinal cord that doesn't even show up on an X-ray.
Oh, wow. So you could easily miss it if you weren't, looking for it specifically.
Exactly, which highlights a key point from all of these documents. You
No.
can't treat children like they're just small adults.
Right. They have their own unique physiology.
Absolutely, their anatomy, their physiology, even their emotional needs, everything's different.
Yeah, I can only imagine how important it must be to have that calming presence for a child who's been through something so traumatic.
Oh, without a doubt. It's about treating the whole patient, not just the physical injuries,
Yeah.
Building trust, explaining things in a way they can understand. That all plays a crucial role in their recovery.
It's that human connection, that empathy that can really make a difference.
Absolutely. And that actually brings me to something else I found really interesting in these documents. It's this concept of damage control surgery.
Damage control. Okay, so I'm already intrigued. What does that even mean in this context?
It might sound counterintuitive, but it's not about giving up. It's about prioritizing. Sometimes with these really severe injuries, trying to fix everything perfectly right away, it's just too risky, too much for the body to handle.
Right, like you're already pushing the limits.
Exactly. So damage control surgery might involve something like, say, temporarily packing a severely injured liver to control the bleeding, stabilizing the patient, and then going back later, when they're stronger, to do a more definitive repair.
So it's like hitting the pause button on the bigger problem to just make sure they get to the next stage, even have a chance.
Exactly. It's recognizing that sometimes the best course of action is the one that prioritizes immediate survival, even if it means delaying a more complete solution.
Wow, that takes incredible judgment, knowing when to hold back, when to go all in. It's fascinating how these medical decisions often mirror those bigger life lessons.
It's so true. It's about adapting to the situation, prioritizing what's truly essential in the moment.
And sometimes accepting that good enough is actually the best we can do, at least for now.
Right. It's about playing the long game, giving the patient the best possible chance for a full recovery, even if it means taking a less conventional route.
That's a powerful way to look at it. We start with that golden hour, those crucial moments after an injury, and somehow we've ended up with like these profound insights into decision-making, resource management, really life lessons we can all apply, even if we're not in a trauma room.
It really makes you think, doesn't it? There's so much we can learn from these medical professionals who are facing these high-stakes situations every single day.
Absolutely. And for everyone listening, we leave you with this. Where in your own life could a little bit of damage control thinking lead to a better outcome? Something to ponder as you navigate the complexities of, just being human. This has been a fascinating deep dive. Until next time.